There are many ways to feed your child through a G-tube or J-tube. One method is giving feedings through a feeding pump. Another method is giving feedings through a syringe or a large gravity bag, also known as gavage method. Let's talk about the feeding pump method first. Some children get a specific amount of formula fed through the tube on a pump at various times during the day and night. This is called a bolus feeding. Some children get their feedings all of the time or for many hours at a time. This is called a continuous drip feeding. There are many different types of tubes. In this video, I will show you how to give a feeding through a low-profile button type of G-tube. An extension set is needed with this type of tube. I will be using a Kangaroo Joey pump in this video. Your child may not have this pump. For detailed instructions on how to use this pump, go to the following website. Gather your supplies: feeding pump, formula, feeding bag, extension set if your child has a button tube, syringe, and water for a flush at the end of feeding. Depending upon the age of your child, this will most likely be 5 to 10 mLs. Wash your hands. If there is a clamp on the feeding bag, be sure it is clamped. Hang the bag on the pole. Pour the prescribed amount of formula into the bag. Turn on the pump. Load the tubing by opening the door and wrapping the tubing around the rotor. Close the door. The tubing will need to be primed, which allows the pump to push the formula through the whole tubing. Program the pump to deliver the formula at a specific rate and volume. Put your child in an upright position if possible. If your child has a button tube, attach the extension set with the clamp closed. If your child needs venting or burping, now is a good time to do this. Attach the feeding tubing to your child's feeding port. Unclamp the G-tube or extension set. Start the feeding on the pump. After the feeding is done, stop the pump. Some children will need extra water. Your child's doctor or dietitian will let you know if extra water is needed. Put the recommended water into the bag. Set the pump volume and rate to give the water. After the water is given, clamp the G-tube. If your child does not require extra water, the G-tube will need to be flushed. This will keep residue from building up in the G-tube. Follow these steps for a water flush. Clamp the tube. Attach a syringe filled with 5 to 10 mLs of water to the feeding port. Unclamp the G-tube. Push the water into the tube. Clamp the tube. Remove the extension set. Be sure to wash the supplies when done with warm soapy water. Now let's talk about giving feedings through a syringe or a large gravity bag. This is also known as gavage method. Some people also call this method a bolus feeding, which is true. It is, just that the feeding is not on a pump. This type of feeding is given over a short period of time and not given on the pump. It is best to give this feeding when your child is sitting upright. Let's get started. Gather your supplies: large syringe or large gravity bag, extension set if your child has a button tube, syringe and water for flush at the end of a feeding. Depending upon your child's age, this will most likely be 5 to 10 mLs. Wash your hands. Make sure the tubing is clamped. If your child has a button tube, attach the extension set with the clamp closed. Attach the syringe to your child's feeding port. Unclamp the G-tube or extension set. Pour formula into the syringe and let gravity draw the formula through the tube. Sometimes the formula may not go down the tube. You can either milk the tube by gently squeezing it, or you can use the plunger from the syringe and give it a slight push into the syringe. Continue pouring the formula into the syringe, allowing some breaks. You can give breaks by lowering the syringe or by clamping the tubing for a brief period. It should take at least 20 minutes to give all the formula. After the prescribed amount of formula is given, pour 5 to 10 mL of water into the syringe to flush the formula into the stomach. If you were told to give extra water at the end of a feed, pour that amount into the syringe. Clamp the G-tube. Remove the extension set. Wash supplies with warm soapy water. Some things to keep in mind. If you have a baby being fed through a G-tube, offer a pacifier while being fed through the tube so they can associate oral stimulation with a full tummy. If your child has a GJ tube, know that one port is for the G-tube into the tummy and one port is for the J-tube into the jejunum. The J-tube must never have feedings given by bolus. Always give by a drip on a pump. Another important thing to do, especially if your child has a GJ tube, is to flush the J-port with 5 to 10 mL of water at least twice daily to prevent clogging. If the G-tube is sluggish, you may need to flush the tube with 5 to 10 mL of water each day, if your child can tolerate it. If your child has a break with their feedings, flush after the feeding is done. Here are some tips on lowering the chance of the tube wiggling at the site. If your child is receiving feedings over a long period of time, be sure the tubing is secured. If your child has a low profile button tube, remove the extension set when not being used. Thank you for watching.